Where are we going? We're going to the park?
Nearly a decade ago, Sonia Flippen found herself slipping away.
Oh, I was just out of it as far as having any kind of energy or wanting to do anything. I cried a lot and I didn't know why. Um, I had awful thoughts. Um, I felt like I wasn't needed or wanted. And it was just to the point where I wasn't myself.
Flippen didn't know where to turn for help, and her family didn't believe she needed help at all.
They thought that if, I just stopped and collected myself, that it would be okay, that I can get better on my own. I can stop feeling this way on my own. Um, but no, that wasn't the case.
The idea that self-reliance can overcome anything, including mental illness, runs deep in Black culture, says psychologist Patricia Harrison Monroe, and it keeps many African Americans from seeking help.
There's considerable stigma in the African American community about the need to seek mental health services, and also a sense that one ought to be able to cope. People have gone through a lot of difficult times, and so needing to reach out, to go to a stranger to talk about some problems is just not something that many African Americans feel that comfortable doing or justified. I don't think they see mental illness as a disease that requires necessarily treatment. It's something that is better dealt with within the family, within the community.
And the statistics show it often is. The U.S. Office of Minority Health reports that African Americans are 20% more likely to report having serious psychological distress than non-Hispanic whites. Yet Black adults and youth are significantly less likely than whites to receive treatment, according to the National Healthcare Disparities Report. Harrison Monroe says these differences reflect a deep reluctance to seek care and a distrust of care providers.
There has really been kind of a tradition, a history of African Americans being subjected to a lot of experimental treatments, both on the medical side, but also on the mental health side. Historically, that's, if we think back to Tuskegee and the studies that were done where people were lied to about what the treatment, quote, treatment consisted of. And so I think in general, there is an attitude of hesitance that comes along with seeking any kind of services.
Part of the problem is a lack of Black providers. Harrison Monroe says she is, to her knowledge, one of only 2 Black licensed psychologists in private practice in all of southern Arizona. But it's not only who African Americans see, says psychologist Fred Wiggins. It's where and when and how they pay for it.
The number of people who have insurance coverage that would allow them to afford to be able to go to receive treatment is certainly disproportionately low in the Black community. I think that part of access, and then also where services are located. Many of the types of services that might be required aren't necessarily in the communities where people live. And then there's the whole we're open from 9 to 5 issue, and I work from 9 to 5. And so in order for me to go get counseling, I have to take off from work. And that is a problem in and of itself.
But even in the face of these difficulties, attitudes are starting to shift. The mental health field is slowly attracting more and more students of color, and both Wiggins and Harrison Monroe say they're seeing more Black patients who are willing to try treatment. Harrison Monroe says it's part of a bigger trend toward less stigma and more awareness around mental illness. Outreach efforts geared to the Black community, and in particular Black churches, have also helped.
We even had some of the participants come forward and say, yeah, actually, you know, I've received mental health, and I've been not letting my congregation know because I've felt that stigma and I wanted it to keep, you know, be kept a secret. But, you know, I need to change my attitude about that, that it probably would be helpful for them to know that their pastor or, you know, their minister has sought mental health treatment.
In Tucson's Trinity Missionary Baptist Church, mental health has always been open for discussion. Pastor Elwood McDowell trained as a psychologist and now works to meld therapy and worship in his congregation.
So much of what I was trained to do in mental health and subsequently going to graduate school while pastoring in clinical psychology fits so well with what pastors do. It's almost impossible, in my view, to separate spiritual growth from psychological growth. I think they're so intertwined.
You can't please him by putting on a religious front. That's right, son. You have to trust in him. Yes, amen. Let us stand and sing.
McDowell says he's just expanding on a role that black churches have played since the time of slavery.
I do believe that we have kind of a built-in psychotherapeutic approach to preaching and worship. And I think that when people have a cathartic experience in worship and allow their emotions to come out about stuff they've been going through, it is therapy.
McDowell encourages the members of his congregation to be open about their struggles. It was here that Sonia Flippen finally found the help she needed. McDowell helped her start counseling, and that led to her diagnosis and treatment. Now, Flippen says, she has a very different and much more joyful life.
I did not know that there was so much help, you know, that I had somewhere that I could take my problems with somebody who understood and knew what I needed to do in order to be better. Want to go this way?
Flippen's experience has also changed how her family sees mental health care.
That was a major turnaround point when everybody understood that there is something going on and it has to be treated. I have to take care of myself. The adults, like my grandmother, who's very supportive, you know, they egged me on. You know, honey, you go ahead and do what you have to do to get better. You know, we understand now.